The standard treatment for patients with advanced or stage 4 non-small cell lung cancer is chemotherapy, or nowadays consideration of chemotherapy and immunotherapy as whole body treatments for the cancer. And sometimes we get very good results with that, but a fraction of patients, usually a minority of maybe 20 to 30%, will have progression of their cancer relatively early and not get a response, but will demonstrate progression on their first scans after they have started treatment. Historically, we have found that the patients who have early progression on chemotherapy, at least, have not tended to respond well to other treatments. But fortunately, there are some other considerations. One is a combination of a drug, docetaxel or Taxotere, combined with another agent called ramucirumab or Cyramza, that is an intravenous antibody treatment given every 3 weeks along with the chemotherapy, and that helps block the blood supply to the cancer. And this combination of Taxotere and Cyramza was compared in a large trial to Taxotere alone as a second treatment option for patients who have already been on and then progressed on first-line chemotherapy. Now, this trial, called the REVEL trial, included patients who had responded, as well as those patients who had stable disease for a while before the cancer progressed. And it also included a subset of patients who had their cancer demonstrate progression within the first couple of months after starting treatment. Now, as I said, historically, these patients have tended to not do as well with chemotherapy because they have already been shown that their cancer is relatively refractory to chemo in general. But in this trial, the REVEL trial, the combination of Taxotere and Cyramza was associated with a better survival than the same chemotherapy alone, Taxotere alone. Importantly, when they looked at the patients who had had early progression, these folks did demonstrate a benefit from the combination that was every bit as good, and in fact tended toward being a little better for the combination compared to chemotherapy alone. So it offers an option of what we might consider for patients who have been on chemotherapy, have had their cancer progress disappointingly early, and for whom we might otherwise have to think, what can we possibly do for them? We can potentially do better by giving them a combination of Taxotere and Cyramza as opposed to Taxotere alone. It's not going to be for everyone. It slightly has it's a modestly higher side effect profile. There's some expense associated with it, but for some patients that is going to be a strong consideration, and the results are associated with a better survival than Taxotere alone for these patients, not only a broad population, but in patients with rapid progression on first-line chemotherapy-based treatment.